At pregnancy week 26, it is important to stay always active. There are symptoms you shouldn't ignore at this week of pregnancy. When you have symptoms such as painful urination, a strong urge to urinate, or a fever, you have to consult your doctor immediately. Hi, my name is Jovita and this is a research-based channel for everything woman. So this is week 26 of pregnancy under a few questions that people ask for this particular week of pregnancy. And you might want to know them so that you can know the next thing to do. It might also be one of the questions that you're asking. So let us talk about key pregnancy questions for this week. Number 1, what are you supposed to avoid at 26 weeks of pregnancy? How do you know at home if your baby is developing normally at 26 weeks of pregnancy? What exactly can cause a miscarriage at this week of pregnancy? How do you know if your baby is head down? What position is your baby at 26 weeks of pregnancy? Can you lie down on your stomach at 26 weeks of pregnancy? What pains are normal at 26 weeks of pregnancy? So at 26 weeks of pregnancy, you don't need to add a lot of weight. This is the time where you should be careful about your weight because every little thing you take or every careless meal you take is going to make you blow up. Because at this stage, your baby is growing just like you are growing. Secondly, you have to avoid toxoplasmosis. And that means every food you eat ought to be cooked properly, like properly. You have to avoid unproperly cooked egg and unpasteurized milk. How do I know my baby is developing properly this week? Number 1, you have to maintain a proper attendance in your antenatal classes. Secondly, you grow as much as your baby is growing. So if you find yourself developing and your baby bump is also developing, your baby is growing. Number 3, your fetal heartbeat is normal. Number 4, you experience fetal movements. Number 5, your maternity weight gain is in progress. Number 6, the position of your fetus. And this position is something that you can actually check, especially when the fetus keeps moving around. You know your baby is developing and your baby is beginning to change positions, and that means your pregnancy is getting along just fine. So number 3, what causes miscarriages at week 26? Second trimester miscarriages occur within the 14th to the 26 weeks of pregnancy, and this can happen due to a medical condition or a health condition of the mother or certain kind of infections. And that's the reason why you ought to pay attention to your body as this journey is concerned and make sure your doctor knows everything that's going on with you. And this, especially when it comes to infections affecting the baby. On the other hand, another thing that can cause a miscarriage could be due to a dilation of the cervix. Sometimes miscarriages can occur due to a dilation, an early or a premature dilation of the cervix, which is something to be concerned about. But this happens rarely. So how do you know if your baby is turning head down? You will note your baby's movement if you feel large movements of the bottom or the leg higher above or towards your rib cage. You know, you start feeling this prickly, ticklish movement. That could be the legs of the baby or the toes of the baby. You will notice your baby's position if you feel movements of the bottom of the legs towards your rib cage. Secondly, you feel your baby's position when you notice the chest area being down towards your pelvic area. Number 3, if you feel hiccups on the lower part of your belly, maybe some kind of butt movement like bop-like movement, it means your baby's chest is below. Sometimes you can feel the baby's bottom or legs above your belly. Yes, the buttock of the baby is up here and then the legs are there. So then you can be able to tell if your baby is facing down or is breached or however the baby is. You'll be able to tell that if you're very sensitive to know the movements of your baby. Can I lay down on my belly at week 26? Research has it that it is generally safe for women to sleep on their stomach while they are pregnant. But I, for one, would not do a thing like that. I usually turn myself to this side or the other side. But I think I kind of figured out that it makes you're even more comfortable when you lie on your left side. I don't know why, but it's more comfortable when you lie on the left side. But you can't keep lying on your left side for the next 40 weeks or 30-something weeks of your life. You can either lie this way or lie this way. But if you know how to do it best, you can lie on your belly. But I'm not recommending that. I don't do that on a normal day. Although it might feel uncomfortable and sometimes you might feel aches, you are safe to lie down on your belly or your stomach until the 30th week of gestation. What pains are normal at 26 weeks of pregnancy? You may have a pelvic pain or a lower back pain. It's normal. You may feel this when you sit down or stand up from a chair or when you walk up and down the staircase. And this is because the ligament in your pelvis may be loose. Most definitely it has loosened because it is preparing itself for the day of labor and the delivery of your child. So that'll be all for week 26. I hope this has helped us in a way or two. Do consider hitting the subscribe button or liking if you do like this video. See you in the next one. Bye-bye.